Norepinephrine is commonly sold as a trade name Levophed. It is a sympathomimetic and a vasopressor. You can consider it either one of those classes. The way it works, it primarily works on alpha receptors, but also has some beta effects. But it is an alpha receptor agonist, which results in peripheral vasoconstriction. Now, about 10% of it or so, give or take, is also beta receptor agonist. So that causes increase in heart rate, contractility, maybe slight bronchodilation effects, but overall, it is a really good alpha agonist with very minor beta effects. So pregnancy class for it is C. Indications can be severe hypotension that's not responsive to fluid therapy for whatever reason. And we're talking blood pressure like 80 systolic, something like that. Another indication, if you have hypotension and it's due to cardiogenic or septic shock, norepinephrine is a good drug of choice versus something like dopamine or epi, something like that. Norepi might be a better choice to make. Contraindications, hypovolemia, we always want to correct fluid first, and then we want to use caution with pregnant patients because it does cause so much vasoconstriction, it can decrease blood flow to the fetus and can really hurt it. Adverse reactions to watch for: headache, dizziness, dyspnea, bradycardia, hypertension, chest pain, nausea, vomiting, kind of all the usuals. And then decreased blood flow to organs like kidneys, stuff like that, and your periphery like your fingers, hands. And so if you were to use a very, very high dose of norepi, we're talking 3-4 times what the normal dosage is, then if you leave the patient on that for very long, it can actually kill their hands and cause permanent damage to that, cause permanent damage to the organs. And because there is so much vasoconstrictive properties to it, it can, you don't have blood flow to your hands or vital organs for so long, you're just not going to work. So you want to avoid super high doses. Or if you're taking a transfer or something where they have them on a super high dose, then you want to double check with the doctor, make sure you got everything squared away and that they're giving the right dose, and that's what the doctor truly wants, and that they know the side effects of it. Don't get in a fight with the doctor over it. If that's what he wants, that's what he wants, or she, either one. Drug interactions: alkaline solutions like sodium bicarbonate may deactivate the effects of it, so we want to use separate IVs and or flush it well between medications. This is going to be an infusion that we're doing with norepinephrine. And then we also want to be cautious that other sympathomimetics, phosphodiesterase inhibitors, and beryllium may increase our adverse effects and cause some dysrhythmia issues and stuff like that. So want to use caution if they're taking some of those other meds. According to the book, typical adult dosing, and also according to AHA currently, is 0.1 to 0.5 micrograms per kilogram per minute. And that's going to be IV or IO infusion. For the kids, according to the book, is 0.1 to 2 micrograms per kilogram per minute. AHA is still the 0.1 to 0.5 mics. And then the Oklahoma protocols kind of dumb it down for us to make it easier, and they just say straight 2 to 12 micrograms per minute. So they take the weight factor out of that. And it's really a good place to start, 2 to 12 micrograms per minute. And that's a relatively safe dose. Like we talked about with the vasoconstriction to the periphery, if you start getting up to like 30, 40, 50 micrograms per minute, then that can really cause some adverse effects and tissue necrosis out there in the periphery and the vital organs. Also threw in that link right there if you want to check out that website for the Oklahoma protocols. It's www.okctulomd.com, and they have a really good resource there with all of our state protocols on it if you want to check them out. Lots of medicines on there and just some really good stuff. Duration of effects: it starts working in about 1 minute or so. It's pretty quick. Peak effects varies, and then within 1 minute after stopping the infusion, it stops working. So do have to keep it going pretty well. And kind of like we mentioned, the only thing to really watch for, only other thing to watch for, is it is such a great vasoconstrictor that We want to make sure we have a really good IV site and larger vein. You know, we don't want to be putting it in like a 24 gauge IV in a hand or something like that. We want to, you know, have a nice AC 18 gauge or something like that if possible. But because it does have such vasoconstrictive properties, we want to watch for tissue necrosis around that IV site and also out in the periphery, just so we're not cutting off too much blood flow there.